Okay. I don't know, right? But digital is fingers, I think, according to Latin. So yeah.
Yes. So you just like your last point now was you talked about using condom. So is condom a proven way? Is it like an effective way in order to prevent transmission of HIV to your partner?
Yes, it's not 100%, right? The efficiency is not 100%, but it does reduce the risk of getting HIV virus. So if it's possible and you have your one partner, go testing first, and then yeah.
So preferably
test first,
and then avoid using condom is preferable.
You can use you want to use condom if you don't want babies, but if you want children at that time, you can.
But you just said now that it's not fully effective. I mean, if it's not effective, I don't want to be a victim or
in relation to HIV and AIDS. Yes, it's not 100% efficiency, but what it does, it reduces the risk to getting actually the virus. So the main effective way is abstinence, or you go for testing with your partner, and then after testing, you now know which state is your partner. Are they positive or negative? And then from there, you guys can decide how to be at risk.
So if they're positive, can you still do anything?
If they are positive, yes, there are drugs that are HIV virus suppressions, like they suppress the activity of that virus, so you can, and that is now like the main process that they are using for pregnant women, for them not to transmit the virus to their babies now.
Yeah, but that's to the mother risk. I'm looking at like, God forbid, like in terms of like a man and a woman, the man is the one who is HIV positive, being confirmed, but like in order not to transmit the disease, that will prevent it from coming to the wife.
Yes.
And she'll be able to give birth through the regular
yes.
And what also be like,
yeah, so the suppressants can still work with your partner. Any other questions, guys?
So let's say you have like a cut on your lip and you maybe have it to transmit?
Yes, I said any human body fluid. So whether it's your secretion, saliva secretion, it does, as long as it gets to the bloodstream, and then also it gets in contact with the CD4, which is the T-opers, it will transmit. Yeah.